All right, let's dive into a really fascinating class of drugs. They're kind of like a master switch for your body's entire autopilot system. We're talking about ganglionic blockers. So let's just start with a question. What if there was one single drug that could just shut down your body's entire autopilot system? I mean, think about it. The stuff that controls your heart rate, your digestion, your blood pressure, all that background stuff you never have to consciously manage. Okay, so picture this clinical puzzle. A patient's blood pressure just plummets. Their vision gets blurry, their mouth is bone dry, and their digestion basically just stops. All of these things seem totally unrelated, right? But they're not. There's a single cause behind it all. And to figure out how that's even possible, we gotta look at the system that's being targeted. And that system? It's the autonomic nervous system, or the ANS. This is the master controller of pretty much all of our involuntary functions. The ANS has these two main branches, and you can think of them like a gas pedal and a brake for your body. You've got the sympathetic system, that's your fight or flight response. It's what gets you all revved up for action. And then you have the parasympathetic system, the rest and digest side. It's all about calming things down, conserving energy, doing the housekeeping. They're in this constant tug of war to keep your body perfectly balanced. Okay, and here is the absolute key to this whole thing. Both of these systems, the gas and the brake, they use the exact same basic wiring. It's a two-neuron pathway. The first neuron sends out a signal using a neurotransmitter called acetylcholine, or ACH for short. That ACH travels across a tiny gap and latches onto something called a nicotinic receptor on the second neuron. This all happens in a sort of control hub called an autonomic ganglion. Once that happens, boom, the second neuron fires off and carries the message to the target organ. And that little control hub, that ganglion, that is exactly where our mystery drug does its work. So let's finally unmask the culprit. These drugs are called, you guessed it, ganglionic blockers. The name says it all, right? They block the autonomic ganglia. Specifically, they're what we call nicotinic receptor antagonists. That's just a fancy way of saying they literally sit on the receptor and block acetylcholine from binding to it. The signal just gets stopped dead in its tracks. Think of it like a busy intersection in a city. The ganglion is that intersection. Acetylcholine is the green light that says go. Well, a ganglionic blocker comes in and acts like a permanent red light. Or maybe even better, it's like a giant roadblock thrown right in the middle of the intersection. Absolutely nothing gets through. If you're ever flipping through a pharmacology textbook, you'll see a few classic names pop up, like hexamethonium, trimethophan, and mecamylamine. They're all part of this family, and they all work in this exact same way. And this right here, this is the most important concept to get. These drugs, they don't pick a side. They are completely non-selective. They don't just block the fight or flight system, or just the rest and digest one. Nope, because both systems use that same nicotinic receptor setup in the ganglia, these drugs shut down both. They just cut all the wires indiscriminately. Okay, so you're probably thinking, if they block everything, how on earth do you get that specific set of symptoms we talked about at the beginning? Well, this is the big reveal. This is where it all clicks. Here's the secret. The effect of the drug on any organ depends entirely on which branch of the autonomic nervous system is normally the one in charge. This is a concept we call dominant tone. Let's walk through this. Take your arterioles, the tiny blood vessels. The sympathetic system is usually the boss there, keeping them a little bit squeezed to maintain your blood pressure. So, what happens when you block that signal? The vessels relax, they dilate, and your blood pressure just tanks. But now look at the heart. At rest, the parasympathetic system is dominant. It's the brake, keeping your heart rate nice and slow. So if you block that brake, what happens? The heart rate speeds up. It's the same logic for everything else. The parasympathetic system is in charge of keeping your pupils small, your gut moving, and saliva flowing. Block it, and you get big, dilated pupils, constipation, and a super dry mouth. So you see, all those things we'd normally call side effects aren't really side effects at all. They are the main effects. They're the totally predictable result of shutting down the whole system. All those mystery symptoms from the beginning, they make perfect sense once you understand this idea of dominant tone. And that is why these drugs have such widespread effects, and why, historically, they were so tough to manage. Which, of course, brings us to their clinical story. It's a classic tale, really. A groundbreaking drug that was eventually replaced by newer, smarter, more precise medications. And you really can't overstate how important these were back in the day. A drug like hexamethonium was an absolute game changer. I mean, it's been called the first effective drug ever for treating severe, life-threatening high blood pressure. So for a while, they were a go-to treatment. But as we've seen, that long list of side effects from wiping out the entire ANS, well, it was just too much. Patients found them really hard to tolerate. So today, they've been pretty much replaced by safer, much more selective drugs. You might only see one, like trimethophan, used in a real pinch, like a hypertensive crisis, or to deliberately lower blood pressure during a really complex surgery. So while they've basically retired from the pharmacy shelf, their legacy is totally secure. Their true value today isn't as a medicine, but as an incredible teaching tool. There's no better way to understand how the autonomic nervous system works than to see exactly what happens when you shut the whole thing down.